Signs of abuse in an elder can come in many forms. I've had some patients who I've seen for depression, and in getting to know them, we find that part of what they were struggling with was some form of abuse.
Some red flags might be if you have an individual who was getting out into the public, was active, and now is suddenly homebound, or you're not seeing that person anymore.
Well, when I see patients in my office, I'm often kind of keeping an eye down the hall as they walk in. Kind of starts in the first chance I get to see is kind of assess people's safety and functioning. So as they come into the hallway, and then who do they bring along with them? Do they come by themselves, or do they come with someone else? And then the thought process, who is that person and why are they with them? So I may get a clue right from the beginning, something's not quite right here.
Look around. If you see different types of behaviors, the hoarding behaviors that we can often recognize when we go into elderly people's homes. Most officers are already aware that you check the refrigerators, and if you see food that's sitting out on the counters that are spoiling or things like this.
More obvious would be is if you would come upon somebody that has injuries or signs of neglect. And of course, most obvious with fraud would be if there's unusual activity in somebody's bank account.
It's just maybe as a sign that there's not somebody with a family, or there's nobody really keeping a close eye on these folks. And maybe what they really need is somebody to kind of help them out.
Aging Resource Center of Milwaukee, S.A.N.E speaking. Elder abuse, there's a lot of different types of abuse. It can be either physical abuse, sexually abuse, financial exploitation, and self-neglect too.
Would you like us to come up? And would she listen to us or be interested in at least talking to a worker from our office?
And I take a look at the setup, explain how the program works.
Would you like to make a referral? Okay. What do you have for
Any problems with your heart?
What kind of medical diagnoses or conditions does she have now? Does she have congestive heart failure or
Cataracts?
any history of stroke or heart attack?
I understand it. You take medicine?
So she's bedbound.
The majority of the calls again are from the social workers and the nurses and the clinics that are out there, caring neighbors, people that have no relationship to the client sometimes.
One of my recent cases started with an elderly couple who came into the police department actually, and they were complaining that their son was writing checks on their checking account and that they hadn't given him permission. We checked into it, see if we could get anything issued as far as him taking advantage of a person with diminished capacities or reduced capacities. And the DA's office wasn't able to charge anything on that. But the neat thing was we were able to contact the Department of Aging, and because the son had kind of screwed up the finances for the couple, they were able to get some legal assistance in and help them start sorting the whole situation out.
The referral source should always be confidential. I take the phone call and I summarize it, type it up, log it into the computer system. Then the supervisors will triage them.
Send it AODA first and then refer it back.
So he's home alone.
Right. He relied on his wife for all that support.
I'm gonna put it in as elder abuse, self-neglect to Mary.
When I was talking with the intake worker, they let me know that they'd be sending somebody out to interview the couple. So I was able to tell them who to expect and about when they would be coming to visit them, and they were okay with that. So I really didn't have to be involved after that. A couple days later, I got a phone call from the department, and they told me that they'd had a good interview with the couple and what they were going to do to help them out and what kind of resources they were going to pull in for them.
But anybody can, and hopefully will make those calls. You want a Russian-speaking worker? All right, I'll open up the case for you. And someone should call you shortly, okay? Okay, have a good day. Bye.
There are multiple reasons why an elder abuse victim would be reluctant to talk about what's happening to them. They may have dependency on the person who's abusing them. So for example, they may depend on that person to take them to the doctor, to take them shopping, and to even spend time with and companionship with them. So to talk about that person as being abusive to them may risk losing them in a relationship.
I've been trained to think about medical diagnosis, about heart failure and diabetes and dementia, but really I think what we really need to do first is think about people's safety and their function, and especially with older people. You know, are they in a safe environment? Are they functioning appropriately in that environment? Or are they unsafe because of their illnesses, or because of the setting or the people that are around them? And it may be that the people around them are problematic.
Sometimes it's shame. This is happening to me and I never would have expected it, and no one else would know about it either, and to reveal that would be the ultimate shaming experience.
Very recently we had a situation, it was a neglect situation where an elderly person who was somewhat wheelchair bound was caring for their adult son who was mentally handicapped and physically handicapped, and it was obvious that she was having difficulty much less caring for herself as for also caring for this handicapped son. It didn't amount to a criminal case, but it was a case where we involved the Department of Aging to get involved and see if there was some services they could offer.
Fear might be another factor that keeps a person from revealing abuse. They may have been threatened. If you tell someone, I'm putting you in a nursing home and no one will come and visit you, or I will hurt you, and you know, and that that threat might be real. Part of my job is to be supportive of my patient and judgmental about the abuse. It's wrong. It should not be happening. And then let them know of the options available to them, such as contacting Milwaukee Department on Aging, doing safety planning for themselves, contacting law authorities if they feel in danger for their safety, and so on.
There's a gentleman that always comes to mind because he's been my patient for a long time. He has some mental health problems. He lives in public housing. He had very bad sleeping habits, eating very poorly but he got by. He came in and he looked disheveled. I mean, he wasn't taking care of himself any longer. He didn't know where to turn. So we called the Department of Aging, and then they had a social worker come out and kind of assess him and try to help him get hooked up with family care and some other services in the community. I think he's doing better. I'm still worried about him.
I would say that it's very much the same as our obligation when dealing with children. If we feel we have a situation that isn't appropriate but may not rise to the level of criminal, with a child we would make a referral to social services. With an adult, a referral should be made to the Department of Aging.
If you suspect abuse, don't just kind of say, well, that's not my job. I mean, I'm sorry that that's happening, but there's nothing I can do. I mean, there are community resources to help you, and I think as a physician or healthcare professional, we kind of have eyes to see things that people in the community may not see.
The Milwaukee Department on Aging fills an important gap in that they're able to contact the person and focus directly on the abuse issue, and if necessary and allowable, to do an evaluation of that abusive situation in the home setting, and then recommend services directly addressing the abuse issues for that person.
The sad thing is that oftentimes the phone call never gets made to the Department of Aging. Whether it's a police officer who's got 3 or 4 calls waiting for him and he just doesn't have the time to make the phone call, or doesn't really have the time to sit and really assess the situation, or if it's a neighbor who just doesn't really want to get involved and they wind up calling the police because they really don't know what else to do or don't want to get any more involved in that. A lot of times the calls are anonymous. So sometimes people are afraid to get involved, but don't be afraid to make the call.